Look, our lives have been changed and challenged by COVID-19, you would agree. We are reflecting on the glut of loss and suffering caused by the pandemic this morning. We are learning daily about the deleterious effects of this disease. What about coping with COVID fatigue as we try to navigate through a third wave of the COVID-19 pandemic in South Africa? What lessons have been learned that will give us some sort of, operating license and plan for the next pandemic? Because there's probably going to be a next time, isn't it? We've got to get to a better place as soon as we can. How do we do that? We're going to bring in the better minds onto the program this morning and get you some answers, get you the state of play with regards to the situation on the ground in our fight against COVID. Please keep in touch on Twitter. We at the agenda _SABC. What do you say, my brothers and sisters? Let's set the agenda. The first hour of the program starts right now. The coronavirus positivity rate in the country has declined to 24.3%, with 12,056 new cases reported in the last 24 hours. The figure is significantly lower than the more than 30% reported in the beginning of the month. Another 413 people succumbed to the virus, bringing the death toll since the beginning of the pandemic to 69,488. All right, I want to get the very latest with regards to where we are in the fight against COVID-19. We are now joined live by the National Institute of Communicable Diseases Acting Executive Director, Professor Adrian Puren. Professor, always a pleasure having you on the program. Welcome.
Good morning, Blaine, and thank you for the opportunity, and good morning to your viewers.
So we see the COVID-19 infection cases continue to fluctuate. The latest numbers as provided by the NICD is that we have 12,056 new COVID cases that have been identified in South Africa. This increase, as I've mentioned at the top, represents a 24.3% positivity rate. As per the National Department of Health, a further, and it breaks my heart to say this every day, further deaths, 413 COVID-19 related deaths have been reported. What's your take, Professor? What's your read on the latest numbers and the direction we're heading as a country?
Yes, so I think overall, Blaine, that the numbers certainly indicate that we are on a downward trajectory overall. And I think that that's very good news for the country, but we're not, haven't reduced, as you've mentioned, the positivity rate, for example, and the incidence is still substantial. So we still have a way to go in terms of declaring that this particular third wave or resurgent is actually over. We also need to look at particular provinces. I think the trajectories are for Gauteng, for Limpopo, Mpumalanga. Certainly, I think the peaks have been reached there, and certainly there are declines in the numbers as well. Western Cape looks as if it may well have reached its plateau, and so hopefully we'll see declines there. And similarly with Eastern Cape, I think there's an upward trajectory, but we'll see what happens there. I think the concern, has been, because that's been the province that's been severely affected by the disruptions last week, is KZN. In terms of the testing, either because people were not able to test or because there were disruptions in testing. So although we've seen a downward trajectory, and that may well be correct, the concern is that we may, because of these particular disruptions, we may see an inflection. And I looked at the curve this morning, and there is certainly some inflections, but we need to monitor that over the next few days to see whether that is a true increase or just a blip in the systems that we're currently monitoring.
And as you mentioned, although we're seeing this downward trend, the numbers are still quite high. When you look at Gauteng, the latest numbers is 3,670. When we hear that the numbers are going down, there's the risk of complacency creeping in. You worry about that?
Absolutely. I think, I know we talk about peak as if that's it. But yes, we still have a way to go. And you're quite quite correctly mentioned that at critical point, we still have hospitalizations and we still have deaths. So it's still really important that we stick to those non-pharmaceutical interventions, the physical distancing, the wearing of masks correctly, the avoiding of super spreader events, the avoiding of large crowds, the avoiding of large numbers of people in the same congregant settings. So all of that still remains a very critical point, because we're seeing the lags, and the lags are the hospitalizations and the deaths that are currently occurring. So it's really important that we do not become complacent. I know we have a vaccine program, but again, it will have some effect in terms of this particular resurgence, but not to the extent that we had hoped. But it's certainly, this vaccine program is really critical for, obviously, the prevention of future waves.
Well, the acting Minister of Health said on Friday that we are currently vaccinating at a rate of more than 250,000 per day. You satisfied with that rate?
So I think that rate, I'm sure they would, I think the President even asked for a higher rate. In fact, that would be quite great if we can reach even more in terms of the numbers, because it's really, really critical that we have a marked coverage in order to prevent infections. As you know, with the Delta variant, for example, that we have currently, even though we had set the bar at about 67% of the adult population, given that this particular variant has a high degree of transmissibility, it really becomes critical that we really maximize the numbers of people that can be vaccinated. And therefore, I really would encourage people to go and get vaccinated, and those individuals that have received at least their first dose and waiting for the second dose, as soon as that those appointments arrive, please to vaccinate. I think there's really good evidence to show that a 2-dose vaccine regimen, at least for the Pfizer vaccine, is really critical to provide the necessary protection.
Let's talk about the vaccines and certain do's and don'ts before and after getting the vaccine. I got my first dose of Pfizer on Thursday. And then, because I'm allergic to penicillin, I was told to sit and wait for about half an hour compared to the 15 minutes that normally the assessment, after you have your first dose. But I wasn't told about what not to take, what to take. My wife went the next day and she was told that she needs to stay away from alcohol for 7 days, stay away from aspirin for 7 days, immune boosters. Any truth to that? Is that correct advice?
So sometimes there are factors that may interrupt the immune responses. So, for example, again, I'm not sure what because again, it's not an area that I specialize in terms of, for example, disruptions by alcohol, for example. So that may well play a factor or role in terms of immune suppression. So certainly those types of considerations are important, especially if you have particular medical conditions as well. As we know that there are these very rare side effects, again, which people need to be aware of. And if they are on, for example, antithrombotic type or blood thinning medications, then that's an important consideration in particular age groups. So I think it's really being aware of your particular medical conditions, having discussed that with your medical practitioner. That includes, for example, healthy conditions such as pregnancy. Again, people may well have considerations around whether or not there is risk. What are those risks and how to manage that, or if they're breastfeeding. So those are really important considerations in the healthy and those who may have medical conditions for consideration.
We have some do's and don'ts that we picked up from UNICEF. I'll just put it on the screen. I hope you can see it with regards to certain things that you need to do or protect yourself after the vaccine. For instance, I went for a run yesterday for about an hour. And when I came home, I had such fatigue, such tiredness. Maybe I'm using the term wrong, but normally I wouldn't feel like this after an hour's run. Is exercise still recommended after vaccination?
My sense would be that the vaccine is there to boost one's immunity, but one of the side effects of the vaccine, again, you can't always, if you've gone for a run and feel fatigued, it may well be part of that within that period of time, for example, that the effect of the vaccine is actually to induce fatigue, so you can't always may not be able to distinguish that. The exercise does not consequentially produce fatigue. It may well be the association that you've had the vaccine, and that vaccine certainly induces fatigue. It can induce various other systematic effects, and also, for example, localized effects in terms of the vaccine site, where you may well have pain, for example. But these side effects should actually resolve within a space of 72 hours or less than a week. But if they certainly persist, then of course you would like to ensure that you do investigate what those side effects, why are they persisting, for example. But in the main, the majority of us will have some side effects, but those will resolve in time. And with moderate use of, for example, antibiotics, for example, fever will certainly be reduced, or pain reduced.
My understanding, Prof, and you can correct me if I'm wrong, is that the vaccines work by tricking the body to believing that the body has the virus, and then the body mounts this defense. Is that correct?
Yes, in essence, yes. In other words, the vaccine is, if you like, mimics the foreign bodies that are going to be, if you were to be infected, will then respond appropriately. There's the so-called non-specific responses to the vaccine, as well as specific responses, and we are particularly interested in the specific responses, especially around, for example, antibody responses, T-cell responses. So these are called the adaptive immune responses, and we hope that these responses will be mounted. And as you know, you've just had a single dose of the Pfizer vaccine. It's really thought that you need 2 doses of the Pfizer vaccine to really have the most effective antibody responses, whereas the Johnson & Johnson currently that's used in the country will just require a single dose in terms of responses. We must bear in mind, though, that it's a critical discussion to have, that even though we have these vaccines and they're powerful and effective, that there's going to be a proportion of individuals that are going to have what we call, it's an unfortunate term, it's called breakthrough infection. So there's going to be a proportion of individuals that will have, and there are 2 levels or 2 categories that we need to consider. One is they may have a very asymptomatic infection, even though they've been vaccinated, and we don't really always monitor for those. And there may be some mild infections that occur, but also, unfortunately, a small proportion of individuals may still have a serious outcome, even though they have been vaccinated. Yeah.
So what's research telling us with regards to vaccinated people who contract the virus? They don't get very sick, but who pass it along to others. Is that a concern?
That is of concern, but I think that there is evidence to show that at least the viral load is certainly reduced in terms of those individuals who have these so-called breakthrough infections. So it's thought that the onward transmission is probably less likely in the case of a vaccinated individual. However, that does raise this whole point around, even though we are trying to vaccinate as many people as possible, I think the non-pharmaceutical interventions will remain with us for a while until we reach that point of so-called herd immunity or community immunity. That I think that still is going to remain really critical. So again, even though you have actually been vaccinated, it is still important that you wear your mask, that you still have the non-pharmaceutical interventions in place, such as the physical distancing, avoiding congregate events. So all those things that we've been speaking about in our current situation, in the absence of vaccine, still remains. So if you come into contact with an individual, or know that you've come into contact with an individual that has the infection, and you've had close contact but are vaccinated, you may still want to go into quarantine, for example, because there is still a risk that you can become infected.
I was just listening to a former US testing czar the other day, and he was saying that with the Delta variant and other variants, vaccination becomes so much more important. Why? Well, he says that the data is showing that natural immunity, although it's good against the basic strain, it's not so good against Delta. So people who were infected might be susceptible to Delta and new variants. Your take on that?
Yes, so it's an important consideration, I think, at 2 levels. One is that, yes, even if we did not have the vaccines, the Delta variant certainly is highly transmissible, and that's based, I think, or some of the evidence points out to a higher viral load. I don't know if that's the complete explanation in terms of transmission. Therefore, again, the wearing of masks and reinforcing the wearing of masks becomes critical. Under conditions of a vaccine, I think there is evidence that there's reduction in terms of the responses. However, those responses, I think, are still fairly effective. I think if you look at some of the papers that have come out from the UK, for example, and again, that's why I stress the point about if you're on the Pfizer vaccine, please have that second dose, because I think the evidence does show that there is still protection against the Delta variant with a single dose, but the most effective way in which it will work is when you have the second dose in particular. So yes, variants are of concern, and that's why they are called variants of concern, because of higher transmissibility and because of immune evasion. But I think overall, my sense is that the vaccines remain effective, even though the effectiveness may have been reduced. It still provides you with a measure of protection in terms of disease and hospitalization in particular. So I think I would still encourage people to have these vaccines currently.
What level of protection do you get after, say, a first dose of Pfizer? Do we know that?
I think, if I recall, it's about 30 odd or above that particular level in terms of the period. But then, in fact, then it can certainly then increase up to 80% or thereabouts with the second dose, if not more. But again, remember, there's a variation of responses, because these are biological responses, but they remain effective. And if you recall, the efficacy trials were remarkable in terms of the data, that in fact it showed 90 to 95% efficacy. I think it will be important is to see the real world effectiveness. So there are plans, including for South Africa, to look at how effective these particular vaccines are in the real world scenario.
Just before I let you go, Prof, I know a lot of people are taking immune boosters. It's winter, vitamin C, etc., etc. If you had the first dose of the vaccine, should you carry on with those like vitamin C supplements? Would that mess with the vaccine in any way?
I don't think so from the literature. And in fact, because as you know, vitamin C has always been touted for various infections, for example, influenza and so forth. But my sense would be that these so-called immune boosters are not necessarily, especially if you're in a setting where your nutrition is already well established and is good. My sense is that these immune boosters do not contribute to one's health entirely. I think you really need to be unwell, really need to have deficiencies. So it's really people who need these particular supplements, who are not getting those particular supplements, unfortunately. I think in our particular setting, for you and I, immune boosters, I think, do not have an added value. I know that will draw the ire of many people, but that, I think, is the science in SE, that these immune boosters will not affect your COVID vaccine effectiveness at all.
It's probably a psychological benefit, isn't it? You feel so much better
it may well be.
when you take that. Prof, always a pleasure having you. It's so instructive, as always. Thank you very much indeed for your insight. Be well.
Pleasure.
All right, that was the National Institute of Communicable Diseases Acting Executive Director, Professor Adrian Puren there. All right, so I want to get the latest with regards to COVID-19. As I said, that we are focusing heavily today on COVID-19, giving you the state of play in terms of our fight against COVID-19. The President, Cyril Ramaphosa, is